Hello everyone, welcome to my YouTube channel. Myself Dr. Reza, consultant ENT, currently working in Bangalore. So this video is meant to educate the general public on a topic of earwax. So there have been many queries and OPD visits by the patients for earwax removal. And at many times we have noticed that unnecessarily fiddling with the wax ends up in many difficult scenarios, OPD scenarios. So this video is intended just for the general public to educate them how wax is formed, why is it formed, and when are they supposed to get it removed. The wax is formed by two glands, ceruminous gland and sebaceous gland. This is present in the outer part of EAC, that is the cartilaginous part. So the external aortic canal has two parts: the outer part, which is 8 mm, it is cartilaginous part, more flexible, and the inner part, which is bony part, that is 16 mm long. So total it is only 2.4 centimeter, the total length of external aortic canal. So the wax formed here is by secretion of these two glands along with dead skin cells. So why is it there? So it also has a local immune action in the to prevent infections and to trap the foreign bodies in the external aortic canal. So generally wax formation happens only in the outer part. The epithelial migration in the external aortic canal is towards the opening of the canal outside. So anything that is formed, wax is formed, the red cells, they are shed out, it's shed outside. Red skin cells, which is formed at the root of the hair cells, along with these secretions of the gland, come up to the tip of the hair cells and they are shed into the external aortic canal and this goes out from the canal usually. So the rate is approximately 0.1 mm per day, and this rate varies. For some patients this doesn't happen, this migration doesn't happen of this epithelium, and they have this pent up of this keratin debris like dead skin cells inside the ear. For them, they should get a ear cleaning done frequently by an ENT surgeon or a general practitioner. There are two types of wax: wet wax and dry wax, and this is genetically determined. For some it is wet, for some it is dry. And there are certain conditions which can cause increase in wax production or decrease or hamper the wax production. So these are like if you have fever or in a particular emotional state, or some drugs which can affect wax production. And also unnecessarily fiddling the local trauma, local irritation can also hamper or increase or decrease the wax production per se. Wax very rarely causes any hearing issues unless and until it has been pushed inside the ear canal and it is covering the tympanic membrane. Then it acts like ear defenders. Wax is not usually seen deep in the ear canal, and if it is seen only deep to the ear canal and not in the outer part, only some is there in the deeper part of the ear canal, means it is not wax. Generally, the patients try to remove the ear wax when they have like minor ear block or some hearing issues. But for the clinician, they have to get it removed when the patient presents with ear discharge, ear ache, hearing loss, or anything, any pathology in the ear. That time the clinician has to remove the wax. Now, what you can do to have a painless removal of wax is you can use wax softeners at home, and you can go to general practitioner. You can come to a ENT specialist, or you can do it at home itself. There are wax softening agents like olive oil, turpentine oil, glycerin, sodium bicarbonate. But all of these are not like hard and fast. They will definitely soften the wax and remove it. And at times, very rarely, these agents cause skin irritation. And there are different methods of wax removal. There is syringing method, the other is microscopic or endoscopic wax removal by suction or irrigation. The third one is mopping method. The syringing can be performed by paramedics also when there is a wax which is completely obscuring the external aortic canal and one is not able to visualize the tympanic membrane, or the patient has blocked sensation or itching in the ear. That time the syringing can be done. But the only issue with syringing is that it is a blind procedure. We don't know what is lying beyond the wax, whether the membrane is perforated or not, and also the fluid which is used for syringing, normal saline generally. So if it is not of body temperature, it can induce in some patients vertigo, dizziness. Other method is microscopic or endoscopic suction or irrigation cleaning of the ear. This is done by ENT specialist, and the specialists prefer doing this method for ear cleaning so that they can directly see with clarity the ear canal. They can prevent trauma to the ear canal, and there'll be minimal discomfort for the patient. The last method is mopping technique. This can be done by paramedics or patient relative at home. If the patient has a discharging ear, it's a continuously discharging ear, so we should not be putting ear drops over the discharge. So generally it is better to clean the discharge and then put ear drops. So this for this you will have to use a stick, thin stick I have shown in the picture, and here you have to drape it with the cotton, just as like shown in the picture, but the stick should not come to the tip. Okay, with this you can just clean the ear outer part. You should not be poking it inside the ear. So I would like to request everyone not to unnecessarily fiddle with your earwax. Let it stay there unless and until it causes any symptoms. Don't unnecessarily forcefully clean your earwax using earbuds or any other pins or keys or anything. So with this I would like to conclude my video. I hope it was informative for you, and if any doubts or queries, you can post your comments below this video. I'll try my level best to answer all these queries. Thank you.